The pancreas is one of the organs in human body that produces the hormone insulin. It plays a major role in regulating blood sugar levels, and when the body does not respond appropriately to insulin, a condition called insulin resistance surfaces. Reports by the International Diabetes Association, IDF, indicates about 422 million people worldwide have diabetes, most of whom live in low and middle income countries. This is accompanied by an estimated 1.5 million deaths every year. The worry here is that both the prevalence of the disease and mortality have been steadily increasing over the past few decades among people of all ages. For these diabetic patients, access to affordable treatments, especially the availability of insulin, is critical to their survival, going by the globally agreed targets to halt the rise in diabetes and obesity by 2025. This week on Global Health Digest, we will highlight the level of awareness of the growing burden of this health challenge on the African continent, as well as strategies to prevent and manage the disease, and of course, the Nigeria situation. Welcome to Global Health Digest. I am Uche Ugochukwu. Let's have an insight into this disease, diabetes.
The term diabetes is the shortened version of the full name diabetes mellitus. Diabetes mellitus is derived from the Greek word diabetes, meaning siphon, to pass through, and the Latin word mellitus, meaning honeyed or sweet. This is because in diabetes, excess sugar is found in blood as well as the urine. It was known in the 17th century as the Piscine evil. It is a chronic health condition that affects how your body turns food into energy. Diabetes was first recorded in English in the form diabetes in a medical text written around 1425. It was in 1675 that Thomas Willis added the word mellitus to the word diabetes. This was because of the sweet taste of the urine. This sweet taste had been noticed in the urine by the ancient Greeks, Chinese, Egyptians, Indians, and Persians, as is evident from their literature. Greek physicians prescribed exercise or some forms of therapy applied to diabetes, including wine, overfeeding to compensate for loss of fluid weight, starvation diets, among others. In 1776, Matthew Dobson confirmed that the sweet taste of urine of diabetics was due to excess of a kind of sugar in the urine and the blood of people with diabetes. Also, in ancient times and the medieval ages, diabetes was usually a death sentence. The ancient Chinese tested for diabetes by looking at whether ants were attracted to a person's urine. The Korean, Chinese, and Japanese words for diabetes are based on the same ideograms, which mean sugar urine disease. Diabetes is of two types, type 1 diabetes and type 2 diabetes. Type 1 diabetes, previously known as insulin-dependent, juvenile or childhood onset, is characterized by deficient insulin production and requires daily administration of insulin. Type 2 diabetes, formerly called non-insulin dependent or adult onset, is largely the result of excess body weight and physical inactivity, which results from the body's ineffective use of insulin. More than 95% of people with diabetes have the type 2. Over time, diabetes can damage the heart, blood vessels, eyes, kidneys, and nerves. Adults with diabetes have a 2 to 3-fold increased risk of heart attacks and strokes. Combined with reduced blood flow, neuropathy in the feet increases the chance of foot ulcer, infection, and eventual need for limb amputation. People with diabetes are more likely to have poor outcomes for several infectious diseases, including COVID-19. There isn't a cure yet for diabetes, but losing weight, eating healthy food, and being active can really help.
The World Health Organization estimated the prevalence of diabetes in Nigeria to be 4.3%, largely due to lack of knowledge and the lifestyle changes caused by urbanization, among others. Against this background, we went to the streets to assess the level of awareness of Nigerians.
So Blessing, tell us what you know about diabetes. Okay, basically, diabetes it's high sugar level in the body, contained in the insulin or something. I don't really know. I'm not a doctor. I can't tell you. No, I've not. I've not. I've never checked my sugar level.
Why not?
But I believe my sugar level is fine.
How often do you check your sugar level?
I've actually not checked, but I know I don't have my sugar level is normal. But
How can you be sure when you have not checked?
the symptoms and the feeling, I'm always okay. I've never been ill. I'm a young guy, so I do work out.
They used to say that if you are eating too much sugar, it will cause diabetes. And some food we don't supposed to eat, like some will say gari or rice.
I'm still young, and they said young people does not have diabetes. It's either you're growing old, and as you're growing old, you discover that your eyes are closing and you're getting more weaker. So it's because of the sugar in your body. So I don't go for checkup. I've not gone for checkup before.
I think we should just put it in layman language. When someone has excessive sugar in his or her own body, then from there you develop the symptoms of diabetes. And they have the A type and the B type. So when it grows to become the B type, it goes beyond someone's control. And that is why it's advisable for us to watch our diet and whatever thing we take at home.
Let me give you an example about me. Before no be like this I be. I think say me I know and say no be diabetes because me I go test this is 3 times. When some of my friends see me say I slim, they say what happened for you? Oh you diabetes because I say me I don't go test.
From my own experience before I came here, I was losing weight. Then I always at least go to toilet every 1 hour. Then 2, I have a blue vision. I don't see clearly. So, but I realize that anytime I eat something that is starch, I don't get myself.
Good to know the people are not totally ignorant about the dangers of diabetes. However, a consultant endocrinologist and diabetologist, Dr. Ramatu Shuaibu, who is also the head of endocrinology and diabetes unit, Department of Internal Medicine at the National Hospital, Abuja, tells us about the state of diabetes in Nigeria.
Right now, with regards to diabetes, the prevalence in Nigeria is 3.7%, with a number of 3.6 million Nigerian adults between the ages of 20 and 79 being diabetic. That's the figure we currently have. Diabetes is one of the leading causes of foot amputation, kidney disease, blindness in Nigeria. These are some of the figures we have. And these figures are quite large. This is an alarming number. Why? Because we're a country that doesn't have the capability to handle a large number of people with this disease. The disease is very difficult to manage and has so many complications. However, the Nigerian government has set up a national policy and strategic action plan for non-communicable diseases, of which diabetes is the second, following cardiovascular diseases like hypertension, stroke, and so on. Diabetes is actually the second. So we have that committee right now, the Strategic Policy Action Plan. It involves a lot of stakeholders, starting with the Ministry of Health, state governments, local governments, non-governmental organizations, and civil societies, really. There are so many bodies involved, there are stakeholders in this committee. And what are their aims and objectives? These are to advocacy for diabetic patients, to raise awareness, education, and provide support in several ways for diabetic patients. These are actually the aims of this action plan. This is still ongoing. There's a lot left to achieve, though some things have been achieved, but there's a lot still to achieve as regards to diabetes. We need policies to be made, legislature at the National Assembly, which is ongoing, for the benefit of diabetic patients, really, so that they can get access to, if not free, but cheaper health care, access to drugs which are quite expensive, and really to have a plan for those who have complications, how to take care of them and so on. Also in the country, there's the Diabetes Association of Nigeria, DAN, which is working with diabetic patients to provide them, with a lot of support too, like in terms of, once again, advocacy for their rights and for benefits. Also does a lot of sensitization and awareness programs. And the DAN actually came up with guidelines for treatment of diabetic patients in this country. So DAN is doing a lot to try for the betterment of diabetic patients. Theme for this year's World Diabetes Day was Education to Protect Tomorrow, which means that we're trying to educate our patients to protect them against the complications. So we have to start now. This has to start now. This is not something that we wait for in the future when we have more cases. It's projected that would have up to 55 million cases by 2040. So we need to do what we can now so that we don't reach that number. In fact, we need to do things to start bringing our numbers backwards, like what they are able to achieve in Europe and America. The expected prevalence or projected prevalence is decreasing, while that of South Africa, especially Sub-Saharan Africa, is increasing every year. So we need to start educating today so that patients won't come tomorrow with a disease or already with complications. This is a preventable disease. We need to remember that it's a preventable disease. A lot can be done to prevent it. So we have a lot of challenges when it comes to diabetes. Number one, there's very little awareness, out there in the communities, there's not enough awareness. So number one thing I would say, we need to raise our awareness much more than we're doing. Like if people can remember the days of HIV, there was so much awareness on TV, on the radio. Now we have the advantage of social media. We can reach a large number of people on social media. Pamphlets, information has to be gotten out there to patients so that they know what they're dealing with, they know about the symptoms, they know how they can tackle them. This is one of the main challenges in Nigeria. But secondly, when patients do get diabetes, there are still more challenges. Supposing we haven't been able to prevent, what can we do then? What we can do then is still to provide education in the hospital about how to prevent complications. And we talk about challenges further. I have to talk about the challenge of the financial challenges that patients actually face. They are unable to afford their care, their medication, and so on. So this is a big challenge. We advocate for patients to get more covering on their health insurance schemes, and for even non-governmental organizations to support diabetic patients. Nobody looks at diabetes, I don't think it's taken as seriously as HIV or even malaria, but it kills a lot of people. It's a leading cause of death and disability. And when we come back to the community, we look at the economic loss that is sustained by complications of diabetes. Patients who get amputations and lose their feet, that's an economic burden. Now, such a person is not able to work, or may not be able to carry out his or her work the way he or she was able to do it before. So it's a problem. What is the economy losing from that patient not working? What is his or her family, what are they losing? And the patient himself or herself, you look at the psychological impact on them. People who are able to do a lot now have become disabled. They've lost a limb, or they've lost their sight, or they have kidney problems, or they've had a stroke, So it's really a big problem. It's a burden on society and the country at large, the economic burden, the psychological burden on the patient. The reason why there are increasing number of cases or projected to have more cases of diabetes in Nigeria is because of the change in lifestyle and diet. Currently, what we have now is a show of affluence has become fashionable. So, with regards to this, people have changed their diet. They tend to favor fast food more than the traditional food we're used to. And most of this fast food have a lot of calories, which lead to obesity, and that leads to increased prevalence of diabetes. Also, there's very little exercise now in our lifestyle because of long working hours, prolonged use of devices. So these are two very key factors in why the prevalence is ongoing. Having said that, I would say that there are also a lot of gaps in the management of diabetes in Nigeria, and these include the poor level of awareness and sensitization about the disease. Secondly, the weakened health sector, which there are not enough health workers trained in this area to manage these patients. And thirdly, in the area of, when we talk about complications, again, the health system is not very strong to support the patients who have complications, like those with kidney disease who need dialysis, those who have lost their limbs, who need a lot of rehabilitation and support, you know. So these are some of the gaps that we have that are, you know, hindering the management of diabetes in this country.
Indeed, the health system in Nigeria cannot bear the burden of complications from diabetes, and so prevention remains the best option for the country. Now, based on WHO's projection that diabetes will be the leading cause of death in Africa by 2030, and that the current 24 million number of adults living with diabetes will rise to 55 million by 2045, we engaged Toyib Abdulkarim via Zoom from Kigali, Rwanda's capital. Abdulkarim is a policy and campaign consultant with NCD Alliance. He is supporting the organization's work around non-communicable diseases prevention.
In terms of like diabetes and the African continent, I think it's very, very important to clarify that it is not that we are alone in this problem. It's a global issue. There's a lot of industrialization happening, urban migration happening, and that means that people are living their old lifestyle, the traditional lifestyle. There's a lot more people that were farming in the past. There's a lot more people that were using bicycles in the past compared to today. In terms of our own context on the African continent, the challenges are a bit different. So like the first thing that you'd see, and this is something that cuts across the health sector, is that there is the paucity of data and research. We don't have enough statistics to inform policies, to inform legislation. We do not know, for example, the number of people that are going to specific facilities as regards, living with diabetes. And this would inform possible policies. People do not have access to care. And that implies, that have implications of if they're able to diagnose, if they're able to get care, if they're able to even get palliative measures if they're living with diabetes and other chronic diseases. So that plays into how the growing prevalence that we talked about earlier. In terms of just quickly, in terms of solutions to the challenges, I thought it's very important also flag a bit what we can do. I think we can have an approach that incorporates different health ministries, Ministry of Health, Ministry of Finance. Finance is quite important, but usually people think about health. But the Ministry of Finance allocates budget, has implications for how revenues are generated. And if we are talking about some of the measures to prevent diabetes, it actually has commercial implications. So you have to ensure that you have close allies in trade and economics. So we need a multi-sectoral approach, not just between ministries, but also across the government. So from the federal to the state to the local level. And this is across the continent because we have similar systems of government. Another quick solution is in terms of integration. We have done a lot of work on the continent as regards communicable diseases. We have existing facilities, and these facilities can easily have incorporations of quick diagnosis of diabetes. Diabetes is just diagnosis about using the test strips. And when people come for HIV care, do you talk to them about diabetes? Can they easily do within a minute have their blood sugar checked. Yes, we do have obvious gaps, and I think the first one that we need to talk about is as regards funding. And there's no magic bullets to this, but it's just that there's a huge funding gap. We need to think about how there's like limited resources that goes into like chronic diseases like diabetes, and the quick solution to that is to think about diversification of revenue. So like in addition to the budget that comes from the government, we need to think about other avenues. There are avenues like the public-private partnership. Pharmaceutical industries have a lot of they produce treatment options that we can have some negotiations with them to ensure that we are getting resources, treatment options from them at good value. We could think about health taxes. Nigeria recently, at the beginning of 2022, announced the sugar tax. We need to think about other opportunities. We can increase the tax, ensure that it is best implemented, and ensure that it is earmarked for the health sector, so that it just does not go into the national budget. But there's a need for strategic dialogue as regards that funding gap, because if we don't address it, we are not getting anywhere. People talk about like the NHS in the UK. It's working, even though it has its own challenges, but it is working because there's a fund that goes into ensuring that it is sustainable. The other gap that I would quickly mention is as regards the care that we have, availability and affordability of care. There are PHCs, primary healthcare centers across, but there is the issue of the capacity of these PHCs. I was speaking to somebody from Zanzibar yesterday, for example. They have on paper universal health coverage, but when you go to the facility, you might not find drugs, or you might not find healthcare workers in facilities. You can have a lot of media promotion projects to ensure people understand chronic disease, and organizations like NCD Alliance and other civil society organizations are working in this space, but we need more voices. There's also the opportunity of using community health workers, because community health workers are able to go into communities. They're able to have close contact with people, have communications, share information with them one-on-one, and have some personal approach to how these things are communicated to them. And lastly, because of like the advance we've had in technology and in the digital space, we need to think about how we can leverage digital health to reach more people, to spread messages, have apps that can help people monitor their blood sugar, help people understand a bit how they are doing as regards physical activity, and how all those algorithms can come together to help people understand how they are predisposed to coming down to diabetes.
Early diagnosis through relatively inexpensive testing of blood glucose, as Abdulkarim said, can help a great deal in reversing this ugly trend among Africans. This brings us to the end of today's episode of Global Health Digest. Do not forget, prevention is better than cure. And on this program, we always advise you take responsibility for your health. I am Uche Ugochukwu, and I'll leave you with the tidbits for this week. See you again.